All right, so we'll just give it another 2 minutes. So it's really 1 o'clock. And then we'll get started. All right, so I think I'm going to get started, and I'm just going to do a couple of technical things. One is it's probably easiest to, if you have questions, to ask them through the chat than to pass back and forth the microphone or to ask through the conference line. I find that with these things, when people use the conference lines, there's just a ton of feedback, and then it like screeches in people's ears. So So my suggestion is to use the chat function to ask questions. I will try to keep up with them as they come in. And without further ado, I think I will get started. So welcome to Promoting Positive Experiences at the Doctor and Dentist. My name is Genevieve Lowry, and I am a certified child life specialist. So who am I? For those of you who don't know me or who have never met me, which is actually a couple of people in this particular group, I am a mother of 2. So I do have experience at the pediatrician's office, and I do have experience at the dentist's office. Both my children have required some additional support in both those arenas, as well as additional medical care that required a little bit more work than just a typical well-child visit. So that's why this topic sort of became somewhat important to me to present to parents and to sort of help parents figure out what is the best way, or are there ways to better support your child in those very normal, very typical environments. I am a certified child life specialist. I have been a child life specialist for over 25 years. Child life specialists are people who are trained in child development or developmental experts who are trained to use play and preparation as a way to support children in predominantly healthcare environments. I am also certified in infant massage. I am a Reiki master, which is, if you don't know, a Japanese energy therapy. I am presenting on how to incorporate that into support yourself, your overall well-being, as well as your families. I think that one's next week. I am also trained in guided imagery, and I think I'm doing another presentation on that one. I think is, I want to say the 25th. I have a private practice as a child life specialist, working with and supporting children and families that are facing a variety of different crises, predominantly things where children just need some additional therapeutic play, either post a hospitalization, before they go into the hospital, and they need additional time to learn about and understand what is happening, or as well as working with children of adult patients. I am a consultant as well and have done some consulting work with various nonprofits and other organizations. I am also adjunct faculty at Benton Street College in New York City. I am a published author, and I have lectured both nationally and locally. I apologize also for my cough, but the good news is this is a webinar, and I can't detect anybody. All right. This is my contact information, so if you are interested in learning more about me and my practice, you can go to practicalparentingsolutions.com. If you are interested in making your own teaching materials, this is sort of my fun outlet of DIY child life, where I create videos of me making stuff, making child life things, I should say, not just stuff. Some of them are different types of coping, and some of them are teaching materials. And the Convenient Classroom is an online learning platform that provides professional development units in the form of an online course, including usually 2 or 3 webinars that make child life specialists and other creative arts therapists eligible for professional development units. If you have questions, either following this, any follow-up questions that I don't get to during this webinar, or anything else you want to know, you can reach me at practicalparentingsolutions@gmail.com. So let's get started. All right, so what's all the fuss? So here we have a bunch of images. We have if you guys could also mute your phone, that's helpful, because otherwise everybody can hear. You should still be able to hear me, but we shouldn't hear you. So what's all the fuss? Well, the fuss is that not only has going to the doctor and the dentist sometimes can lead to, whether it be a painful experience, but most children fear what they don't know. So often children don't understand what the different instruments they're going to be seeing and experiencing. It's just really a fear of the unknown of what's going to happen when they go there, and either to the doctor or to the dentist. So helping children find a way to learn about and understand and to break down those concepts for kids so that they're a little bit more developmentally appropriate for kids will go a long way in supporting a child when they go to the doctor or the dentist. So first and foremost, we need to understand your child's fear. So in understanding what is scary to your child about going to those 2 places, first off, pain is what a child says it is. So if a child says that something hurts, then something hurts. And young children don't necessarily distinguish between pain and anxiety. There's not really, when they're feeling nervous or anxious about something, that is basically the equivalent to, in their mind, as experiencing something painful. So it's difficult to, even if you might say to a child, oh, it's a stethoscope, it doesn't hurt. The child has no previous or very limited previous experiences with different types of instruments at both the doctor and the dentist to know whether or not that is actually truthful or accurate. So when kids are presented with these things, they are immediately put on the defensive. Also, there's a natural biological reaction that we have to fear and to pain that is really designed as a mechanism to protect us, and that is our fight or flight response. That when we are in a fight or flight response, children are more likely to obviously either run away from what's going on, somehow fight that experience, and that's what you often see happening. So if we can avoid that scenario prior to it occurring by providing preparation, explanations, coping strategies, information about what the steps are and what's going to occur, then hopefully you don't have that experience occur at all. And therefore you don't get, because once kids are in that fight or flight sort of mode, it's much more difficult for them to get out of it. Gate theory is what allows the child's mind to use distraction to alter the pain experience. So gate theory is sort of like the idea that we can, there's sort of a gate that opens and closes that allows various stimulus to go through. But if there's one that's ahead of that stimulus, that one's going through first. So that's why things like different distraction techniques, different stimulus will alter the experience for the child and distract them from either a pain or an anxiety-producing procedure. So the first thing you want to ask yourself about your own child is, how does your child cope? Is your child an avoider or are they a sensitizer? So avoiders are kids that are like, I don't want to know anything about this. I don't want to know what is going to happen. I don't want to know what's going on, or I want to know very limited information. Your sensitizers are kids who want to know everything. They want to know the step-by-step. They want to know what they're supposed to be doing. They want to know how they can do it. They want to know how the doctor's going to do it. They want to know, and really, really experiencing things in very much all the senses, really looking at what is it going to feel like? What am I going to hear? What am I going to, how long will it take? So the difference between, and why it's important to know whether your child is an avoider or a sensitizer, is really in how you approach the information that you're going to provide your child when you provide that information. Just because a child is an avoider doesn't mean you don't tell them. What it means is that you're choosing a specific time. You're choosing you want to choose a time depending on your child's age that is not too close to the time that then they don't have enough opportunity to synthesize and process that information, ask their questions, and come up with some coping strategies, but give them enough, but not so much time that they've got their head spiraling out of control and now they're creating all kinds of scenarios, and that, that experience goes from being a very simple well-child checkup to, in their mind, being some sort of, extreme torture experience. So your avoiders are your children who you want to give them typically maybe, and this is really about knowing your child the best. This is really about knowing your child. So does your child need a day or does your child need a couple hours? But what you're also going to tell them is you're going to tell them what's happening and what's going on, but you're going to focus more on the coping than on the step-by-step. So you're going to focus more on, here's how you can help yourself feel good. Here's what we're going to do together to see if we can make you more comfortable, as opposed to the actual steps of the procedure. That's not to say you're not being truthful and accurate and giving good information, but that sort of becomes secondary to, here's how we're going to help you get through this, and here's how we're going to help you face this challenge. Sensitizers, on the other hand, are kids who really do want the step-by-step. They want to know all the ins and outs, all the details. So those are kids who sometimes really do need to play it out a little bit, go through it on a doll, practice what's going to happen. And in the process of that, you're giving them or helping them develop, what do you think we can do while you're, I know that, opening your mouth for a long time is really hard at the dentist. So what do you think you can do to help yourself feel more comfortable? Or maybe we can talk to the dentist about giving you a break every few minutes so that you can close your mouth for a second or two, and then talk about how long the break should be. So that you're not only giving the steps to the sensitizer, but you're also giving them ways to problem solve for what some things may turn up to be, what potentially could be stressful points throughout either the doctor visit or the dental visit. Okay, tips or trick. So tips that will help, and then tricks that may work once or twice, but not in the long run. So the most obvious one is obviously to be honest, which we've already begun talking about. It's really important to tell your child the truth. It is incredibly important to let them know that if something's going to hurt, it's going to hurt. But you follow that up with, yes, it hurts, but here's what we're going to do to help you feel more comfortable. I have a tendency, and I think it makes a difference. I think that there's two things going on here when you're being honest with your child or with any child that you're talking to about this, that you, speak in the positive. It's not that I can take the hurt away. I can't. There's nothing I can really, there's some things we can do to maybe diminish that, including topical anesthetics and things like that. But I may never be able to take away that anxiety that it could potentially hurt. So by being honest about that information, yes, you're going to get a vaccine today. We're going to do our very best to make sure that you're as comfortable as you can be, as opposed to we're going to do our best to make it not hurt. So there's a difference in that language. It's also a little bit of a guided imagery technique where you're kind of talking to, you're sort of already instilling a message of comfort and safety for them. When you lie to your child, you're setting yourself up for there to be a trust issue, that maybe the next time you go to the doctor, this time you go to the doctor, you tell him there's not going to be a vaccine, but you really know there is. He gets the needle. You bring it on him at the last minute. And then you go back the next time and there's not going to be one, or the next time your child is really sick, they're crying that they're going to have to go to the doctor. They don't know whether to believe that that's what's really going to happen or not. So it's really imperative that when something's going to hurt, you tell them it's going to, and when it's not going to, you tell them also it's not going to. So they know what to believe is coming on. Validating your child's fears. I know this is really hard. I know this is really scary. I know that you don't like needles. I know that you don't like going to the dentist. I know it's really hard for you to lay in that chair, that position is uncomfortable. That these kinds of statements can validate your child's fears and let them know that they are heard and that their concerns are being respected and that their concerns are also being taken seriously. And that in and of itself will empower your child to be able to better cope with those kinds of concerns. Telling him or her to be a good big girl or big boy, and when I get into advocacy, I'm going to talk a little bit more also about the idea that also not allowing other people to say that to your child as well, that when your child is behaving exactly how they're supposed to be behaving. You know, when someone comes at you with something that could potentially hurt you, we normally have taught our children to stay away from people who hurt us. But here we are in a different environment, in a health-related environment where this hurt is meant to help you. So your own, the parents' own interpretation of and their anxiety about going to the doctor and going to the dentist plays really important at this point. If you are matter of fact when you talk to your child about these things, and your child will respond. If you are, feeling also anxious or nervous about this stuff, or you think of, or you're not explaining that getting these treatments, taking care of your teeth, taking care of your body are ways that your child grows healthy and strong, and that these are things that we do to stay healthy, then your child will pick up on that. So you want to make sure that your child is also understanding the reason and the rationale behind getting well-child visits or getting the treatment and care that they need when they go to the doctor or the dentist. Threatening your child is definitely never something that really works, although as a parent, I can certainly understand why, how people get into doing this, as well as bribing children to do stuff. I totally understand it. I think that there's a difference also between bribery and reward. I think when a child has completed the task, it's okay to say to your child, you did really well with that. Or to find, going back to my tip, finding something very specific that they did well to respond to with. So, you did a great job. It's okay that you were crying. It's totally great that you were crying and you were letting us know that you were really upset by this, but you did a great job holding your arm still. Your child crying does not mean that your child is not doing a successful job. It hurts. These things are scary. So it's okay for your child to cry. What we don't want to have happen is your child to be so upset that they're crying for 10, 15 minutes afterwards, or that your child is so out of control that then they feel that becomes scary to them also, and that sort of exacerbates that scenario. So by providing good information, by supporting your child, and being specific about what they're doing really well. So by saying to even a kid who screams their head off saying, I don't want it, I have often said to kids, I really appreciate you telling us. You did a great job telling us how much you really didn't like that. So you did a great job telling us that. Maybe next time we can work on how to help you feel more comfortable so that it's not as hard as it was today, or something along those lines. So involving your child in the process and involving your child in what helps them learn to cope better, but also validating their fears and their feelings, but recognizing places where they do well and places where maybe next time they need to, you guys can talk about it and work on some more. Okay, so this is one of the first things I would say to really help and support children, especially younger children, your preschool, your toddlers and preschoolers, really need to play it out. They need to understand what happens when they go places. So there's a, Play-Doh makes a great Mr. Mouse that they can make teeth out of. I've made teeth out of Model Magic. I've also made dental tools using, I made a scaler from a crochet hook, and I took a little tiny, like a flat pin, and pulled the pin part out of the face of the pin, and then glued that to like a popsicle stick, and I had the mirror. So I think those are probably the two, and then use like an electric toothbrush to demonstrate sort of giving that, and you can give that to your child to play with. Those are completely safe things for a kid to play with, to understand and learn about what goes on at the dentist, just to lay a doll down in that position. I would say that probably the hardest part of the dentist sometimes is just that position that they have to be in. A child laying on their back is an incredibly vulnerable position to be in, and then opening your mouth for that is also a very vulnerable thing. They can't see what's going on. They can't always see what's happening, and when a child can't see, that's when their imagination starts to kind of take over a little bit. Other things are to play, getting a medical play kit for your child, letting them practice on their doll, letting them practice on you. What's an otoscope for? I mean, these are all kind of these big words: stethoscope, otoscope, standing on a scale. Some of the hardest things for infants is also just getting undressed. It's that transition, those sort of transitions from things. So having something they can dress and undress, put a diaper on, take a diaper off of, can help them just sort of start to become familiar and accustomed to what's going to happen when they go there, when they go to the doctor or the dentist, so that they're much more comfortable with those steps. To us, they seem so benign. They seem so simple. You stand on a scale, it doesn't hurt. But we've done it 1,000 times. These guys haven't. They haven't done it 1,000 times. And they don't know this person. And maybe they've met them once every couple months. And until they're really school age, might they actually feel like they know their doctor if they've been going to the same doctor for a period of time? So by walking kids through the process, by going step by step, this is what you're going to see, this is what's going to happen, standing on the scale, using an otoscope on themselves, their doll. You can even practice some of the coping by letting the child be the nurse or the doctor. They might be listening to the baby's heart or giving a vaccine, and you might want to shake the doll and go, no, no, no. And then the child has to respond with, what they think is the next thing to do. And if they think holding the doll tighter, then you can say, hey, maybe there's something we can do to make the baby feel more comfortable. And then it becomes a dialogue between the two of you about, oh, do you think if the baby sat on mommy's lap? Do you think if the baby, if I held the baby like this with my arms around her, do you think if we sing a song, then you can practice during the play all the coping and all the things, so the child becomes familiar with not just the items and the language and the things that they're going to experience, but also really start developing tools for coping, so that they aren't sort of at that moment. You don't want to go to the doctor's office and say, oh, look, let's blow some bubbles, and then that be sort of, and not having practice. It makes a lot more sense to children if they've practiced what to do, how that's going to work. By the time you get to the doctor's office, not that it's always too late. Some kids are totally receptive to that, and depending on the age, especially if it's a toddler, then that probably will work fine. But a little bit older child, if you've practiced and made a plan with that child, it's going to go a lot smoother. And that brings me to distraction. So in that play and in that process, or if you have a younger child, things that will distract your child so that you are so that your child feels in control of what's happening. So using things like, obviously, bubbles, I-Spy books, party blowers, squeeze balls, pinwheels, light-up toys. If you have an infant, a baby that you are still nursing or that is taking a bottle, that also can be enough of a distraction to feed the baby during parts of the exam, if not at the very least, when any vaccines are given. Children today are getting way more vaccines than certainly I did as a child, and probably the majority of you watching also. They are getting a lot more experiences, and our reaction or an adult's reaction is often to be like, oh, it only hurts for a second. It's nothing. Probably one of my biggest recommendations is to, A, not say that, and B, not ask a child afterwards, so did it really hurt? And because, of course, that child, just to save face, is going to tell you, yes, that it did. And then you've generated a sort of, then what's happened is that a feeling of, yes, it hurts. They've now said this out loud, as opposed to just asking a child, so how was that for you? Instead, saying it more along those lines. So how was that for you? Really allows the child to evaluate what worked and what didn't work for them, as opposed to someone else. Often you find other people will say, so that didn't hurt, right? Which I think is really I think sometimes that's upsetting to a child, and the child feels like they have to save face at that point. Of course they're going to say yes. So squeeze balls are a great one. Pinwheels, light-up toys are great for your younger children. There's two different versions in my picture here of I-Spy books. I like the hard cardboard ones. Are very simple to use. They have big pictures. It's easy to find the picture. Those are great for like your younger preschoolers, primarily because it gives like that instant gratification. Right away they can find the picture. This isn't supposed to be a moment where you want things to be challenging. And knowing your child, whether they're an avoider or sensitizer, helps you also to determine the type, what's the best type of distraction item. If the child is an avoider, an I-Spy book is often a great tool for that. Or something that spins, a light-up toy, something that they have to watch and look away. But for a child who's a sensitizer who wants to watch that happen, who wants to watch the different, getting their heart listened to, the child who wants to watch the needle go in, then something like blowing bubbles or squeeze balls or a pinwheel might be a much more effective type of distraction where they can look away and keep going back from one thing to the other and not feel like they're being told to constantly look away, which also brings me to the point of, if going back to avoiders and sensitizers, that avoiders typically don't want to watch and sensitizers do, and that it's okay to let your child watch and observe. It's a real trust factor for them, that if your child wants to watch, it's totally acceptable for them to want to do that. Or if they want to look away, it's completely acceptable for them to want to do that. Comfort holds. So this is so comfort holds is a way of holding your child so that so the child is in the arms of a trusted, loving adult, typically the parent or caregiver, and it allows the child to often sit in a more upright position, and therefore the child feels a lot less vulnerable. When a child is in that more reclining or laying flat on the bed, that's what brings out that fight or flight kind of response and reaction, where the child is really fighting more the position than they are whatever procedure is happening. So which makes the dentist office a little bit more complicated. So let me just go over a couple of simple holds. I also have at the end there is a sheet there's like two sheets from the CDC that I'll pull up also just to show you that have some great resources on comfort holds, as well as they list some age-appropriate good distraction techniques according to age as well. So in the top right-hand corner picture, the mother has the child on basically the side held to her chest. She can look into her child's eyes and into her child's face, so she can sing a song. She can tell him a story. She can talk to him. She could, if she was still nursing or wanted to feed this child, she could probably also do that in this position. And as you can see, the child is well secured. The child is feeling safe and comfortable, and it also empowers you, the parent. It empowers you as the parent to feel like you are an active participant in your child's care, rather than when someone pins a child down to a bed, you feel like, oh, now my child's going to associate me with this experience, as opposed to here I am lovingly holding my child to support them through this challenge. So it's a different feeling and sends a different message. So the child in the bottom picture, the infant, is probably getting a flu nasal vaccine or something, looks like it's going up her nose. But again, the mother is holding the child. The child is on her mother's lap, can probably feel the mother's heartbeat, and so is responding to that, knows the mother is there, and the medical team is able to do their job and do it quickly and efficiently, so that things are done quickly and over fast for a child. Other positions that you can sit in is chest to chest with certainly for older children with the legs sort of dangling and towards the back, or turning an older child, even having that child sit on your lap. I will say that I stay away from calling this a hug. It's not, and I know that it might feel like that, but still something painful and something uncomfortable is still happening. So I still prefer to refer to it as I'm going to hold you, or it's really hard to hold still. So I'm going to give you the help as your mom. I'm just going to help you do that. And, we're going to work together as a team, and presenting it that way that the child is participating and part of the process, and making it also, when we go, sort of going back to the play aspect, that's also part of the playing, that you talk about what's a comfortable way to sit. Do you want to sit on the table by yourself? Do you want to sit do you want to sit on your mom or dad's lap? Do you want to hold their hand? Or do you want to sit, if you're the parent and you're doing this, how can we sit together? For a dental visit, it's a little bit more complicated because there are fewer opportunities for a parent to obviously sit with their child. When the child is very young, most dental offices will allow the child to sit sort of between the parent's legs in the chair and lean back on the parent's chest, so that when the chair reclines, for some children that still is very difficult, so I would recommend to the parent to ask for, let's count the top teeth and then sit up and take a 10-second break, and then we'll lay back down, count the bottom teeth, and take a 10-second break. But by giving children some of the space that they need, you're allowing your child to have some control over what's happening, and giving those kinds of breaks will help. Another interesting sort of, I don't know if it's really comfort hold as much as I guess it is, a position where the child sat on the parent's lap facing chest to chest, and then laid down so their head was on, and the dentist and the parent were sitting on chairs that were facing each other, and the child's head was on the dentist's lap. And this works well for obviously much younger, sort of toddler. Children usually go to the dentist for the first time around 2, so you probably wouldn't do this much longer than 2 or 3 years of age in that position. It just would be too difficult, I think. And you'd need to at some point start transitioning them to the chair where it really is more appropriate and safer. But I had seen this done once with a younger child, and the child was okay with it because the child could then still see, the parent could still see her mom's face. Her mother could still talk to her. Her mother could blow bubbles. Her mother could sing a song, and it allowed for some good techniques and distraction that the mother was able to incorporate into that visit with the dentist, so the child really was less fearful. At the bottom of this page, I have something that's called One Voice. where really even at this is a technique often used in the hospital, but I think that it's very appropriate for the dentist and the doctor's office that there really is only one person talking at a time, and that one person be designated as that voice, especially during either vaccines or if the child is really crying and upset during having their ears and their eyes checked, their heart listened to, that the parent is the voice that is being heard. And when we talk about advocacy, give you hopefully some inspiration to feel like you're able to stick up for yourself and say, I'd like to talk to my child. And being able to be just that one voice that your child hears, and so that they can calm down by hearing the intent behind their parent's voice. So our ever favorite books. These are some great books that I recommend to parents to use with their children before going to either the doctor or the dentist. It's Time for Your Checkup is written by Shani Thornton, who is a certified child life specialist. It gets really good. I would say this is probably the most comprehensive. I think it's probably better for a parent to read it on their own and look at it and pull out what they think they mean, because it also shows you information about having a blood draw, which many children around the age of 2 will typically need their first blood draw, even in a well-child visit, so that will give you information on that. So it might be a book that you wouldn't necessarily read like a story. You might read sections, but the pictures are of real kids and real parents and the real equipment. So I think it's a great tool and a great resource to use to show your kids what things really look like. The writing is intended for children, but it's a lot of writing, so I think it's really important to pull out what you think is most appropriate for your child. Pooh Bear is just a familiar friend who most kids will know. It's good to use books also. Usually I'm not like a big character-driven kind of person, but when it comes to stuff that's unfamiliar, it's good to incorporate things that are familiar. So finding things that your child can relate to or characters that your child can relate to, my recommendation is that you read them first, look at the pictures. Some of the dentist ones sort of were always about something happened and that's why they went to the dentist. These two were the two that I found to be really just about why you go to the dentist and what happens when you go, and they're less about when someone fills a cavity, which I think is a separate issue. And when the child needs to have something more intense happen at the dentist, but then you look for that book, and then you also go back and play all that stuff out. Play-Doh makes a great Mr. Mouth toy. One of my DIYs shows you how to make those instruments that I talked about. Even just making teeth out of Model Magic or Play-Doh. Playmobil makes a dentist's office as well. So those are all good things to, if your child has to go for something more than just a well-child visit to the dentist, that those might be some things that you want to invest in to help your child cope with that and to teach them about that. Okay, you are your child's best advocate. As your child's parent, you are the expert of your child. You know your child best and how to ease your child's fears. And it's important to trust your instincts and listen to your child. And don't let other people tell you that the best position for your child is flat on their back on the bed. Compromise with them. Talk to them. Talk to the healthcare professional and provider. Talk to them about your understanding about comfort holds and that there is a way. Could you try it? Sometimes it just takes the energy to get them to at least try it. And if it doesn't work, then you say, fine, then we'll do it. But I understand that the person who's giving the injection, that that's a hard position to be in, and we can empathize with that role. But that I also know that it is much, if a child is comfortable and feels safe and protected, that child is less likely to fight. And that is often when we lay children down on the bed, that's what will happen. So by utilizing all the distraction, by utilizing the play, by using all the information prior to going on their well-child checkup, that will help empower you, the parent, to understand and know what is the best thing for your child. Another sort of thing to ask about would be about topical anesthetics. So there is something called EMLA cream, EMLA, which is like a lidocaine base. It does take anywhere from 45 minutes to an hour to sort of soak in. There are other variations of it. Some of them take less time. It is not over the counter. You need a prescription, so you would have to ask your pediatrician about using that. But that is like a cream that goes on that would numb the area where they would get their injection. There is also something called Cold Ease, which is just like a cold spray. Now, some kids don't like the cold spray. My pediatrician just recently busted that out the other day, and I was so very excited. I have a very highly anxious 11-year-old, and she is incredibly nervous about getting shots and vaccines. And so we've done all these little things. We use our Buzzy, which I'll talk about, and we get out I give her, I know she's too old for sucrose to really work, but I still give her a piece of candy to suck on because it makes her feel good. And, we go through all this stuff, and she feels comfortable and supported. She sits up on the table by herself because that's what she's comfortable with at 11, and she's able to do it. I had worked with a 11-year-old girl who had some incredibly traumatizing experiences as a child, getting her vaccines and being seen by a doctor for some other things that she had as a younger child. And by the time she was 11 years old, she needed some vaccine, and she couldn't do it. She could not do it. She really struggled with getting that into literally almost panic attacks. She could step into the office, but once she got in there, she wasn't going any farther. I met with her approximately 4 times. I went with her on the day of the vaccine. It took a lot of time and a lot of patience, and God bless that pediatrician and the nurse that we were working with, because they were, I'm sorry, Vinny, I will answer your question in a second. She was able to do it. And when she had to go back for a booster about 2 years later, or for some other vaccine 2 years later, she was able to recall the tools that she had developed and that she and I had worked on and that she used to face that challenge and that fear. And she was really able to, do it. She was able to get that vaccine. So it's really important that at these younger ages, that when these kids are getting the majority of vaccines, that we set the stage for lifelong health care. That I can vouch for myself. There was no such thing as a pediatric dentist during the 1970s. And as an adult now, and although my dentist as a child was a wonderful, loving, caring, generous man and a very good dentist, there wasn't a lot known about pain management in children and dentistry. So there were some painful experiences. And as an adult, I went years without seeing a dentist. I now see a pediatric dentist because that's what I need. It's like a child life specialist and a dentist, like all rolled into one. So what happens as a child will affect your healthcare experiences as an adult. And it's important that as young children, we set the stage where children feel cared for, heard, comforted, and empowered. And I present this really to parents so that parents can feel heard, comforted, and empowered to best support their children through, although these seem like very simple well-child visits, nothing's painful, there's so much unknown about what happens at the doctor for kids, and there's so much that they just aren't sure about what's going to come around the corner, that it doesn't have to hurt for it to be scary, and it doesn't have to be painful for it to make them feel nervous and anxious. So if we are if we are really supporting children and helping them through every step of the way by providing them with opportunities for play, with information, reading stories about it, children will hopefully develop better lifelong health care. For those who don't know, I don't know who out there is Child Life and who are parents. So I am just going to explain what a buzzy is. A buzzy is a little, like a little bee, or I have a ladybug, and it vibrates and it works off of that gate theory that I talked about earlier, that the body receives that message of, has frozen ice wings, so it receives the message of the cold and the vibration, not the message of the pinch of the needle. And sucrose is really just sugar water that you can give to younger infants, that allows the body to release its own natural sort of pain inhibitors, its own pain management, really, and that works best for younger infants. So, Minnie, I'll get to your question at the end about who wrote this book. I think that the dentist books are both done by DK, so they don't necessarily have like a specific author. This presentation is also being recorded, and I will put it up on my website, so you will be able to, you can also pull those books off of the off of my website as well. So, but I think that they're both they were both written by DK. One was like the first, like their first years, and then the other one was meant for older, like a school-age child. That was an early reader. Okay, so some additional resources, and then I'll take some questions. I'll take some questions in a second. So Child Life Pocket Guide is a website that is actually supervised by me, but written by Bank Street college students. It is overseen by me and a nurse practitioner for accuracy and information. This will also help. It's designed for parents and healthcare professionals on information about going to the hospital, going to the doctor. There are books, there are posts that are specific to bibliotherapy on books that are available about going to the hospital, as well as books about feelings, which I also recommend that when, if you have a child who's already been to the doctor and is already sort of displaying, you know, some fear around that there are some great books about feelings that will help the child to open up about their feelings, identify those feelings, and then it can lead to a really good conversation for you guys, or for the parent, for you, the parent, to have with your child about, oh, I understand that's really scary too. Now I get why you were, now I understand why you were having such a hard time. So there's some great books out there. The CDC, let me just pull this up. I think I can. Let me see if you guys can still see that. Can you guys still see this? How to hold your child during vaccines. So this should, how to hold your child during vaccines. This gives how to do this in different comfort holds. And then the CDC Helpful Hints gives sort of like a breakdown of talking to your child about vaccines, your own attitudes towards them, your own feelings towards them. And this talk and presentation, just as a disclaimer for myself, is by no means an indication of whether or not you should vaccinate your child. That is between you and your physician, but this really is about how to help your child through any well child doctor visit. It Doesn't Have to Hurt is a great video. I think you can YouTube it. It was created by the Canadian Pain Association, I think. It's Dr. Chambers is one of the people on that. So if you even Google her, or if you go to YouTube and type in "It Doesn't Have to Hurt," up comes this video of this cute little girl that's going to get a vaccination at her pediatrician's office, and it's very tongue-in-cheek in the beginning. And then she stops them and says, you know, it doesn't have to be this way. And she talks to them about distraction and Emla cream and things like that. It's actually very good. It would, for those child life specialists out there, it would be great to show your pain management team during Child Life Month because it talks a lot about a lot of child life techniques that we use. Some of the links that I have on here, going to the dentist, Sesame Street, Healthy Teeth, Healthy Me. These are like sites that kids can go to with familiar characters that they know that give them some more information and games and coloring pages and things like that about going to the doctor or the dentist. All right. I will now, okay, so now let me answer some of your questions. I think I answered yours, Vinny. And do I recommend Buzzy for lab draws? I do, actually. You have to follow the directions or else it doesn't work. So the directions are written in the package. They are, you got to hold it on the spot for like 60 seconds, like 30 to 60 seconds. Then you put it above where they're going to go. Unless you're using a topical anesthetic, does it completely remove all the pain? Absolutely not. But it will certainly diminish. I also think it just gives that kid, I also think that any time you involve a child in the process of providing their own comfort, that alone helps them feel more in control. So asking the child whether or not they want to use it, putting an ice pack on afterwards or a warm cloth afterwards. Would you rather have ice cream? You know, by offering that kind of stuff to them or those kinds of suggestions provides kids a sense of control over things. By giving kids a choice, obviously, by giving kids a choice, you know, will you look in this arm before you look in this arm? And if you say it that way, then it leaves open the possibility that you never know which arm is going to happen in. Same thing with the well child visits, you know, should I listen to your heart, should I listen to your lungs first? So I think that the Buzzy will work. You need to follow the directions, but you also have to be clear about the expectations if you're not using a topical anesthetic with it. Does anyone have any other questions? I hope that answered your question. It doesn't tell me if people are typing or anything. I'll just give it a few more minutes, see if people have any more questions. So this webinar is being recorded. I'm going to put it up on my website. And you can certainly feel free to pass it along to others. Certainly use it with parents to share with them if you think it's worth it. I think that's everything I've got. We ended a little bit early. And if there aren't any questions, if you think of anything afterwards, you can certainly email me. You can email me at practicalparentingsolutions@gmail.com. I think that's where the email came from also to sign up. So you should have that somewhere in your files as well, so you can email me there. And other than that, that's about everything. So I hope people enjoyed my parenting webinar on going to the doctor and the dentist. And I hope that it was helpful and useful to you. And if you are a parent and you have questions, don't hesitate to email me. And I hope this was helpful to you as a parent. And if you are a child life specialist, and if you're a child life specialist, feel free to pass this webinar on to your families who you think may benefit from it. So, just to, I don't know, Vinny, if you want me to say that out loud, but she's afraid that her 2-year-old will need to be mastering his first dental visit. I'll tell you, he wouldn't be the first 2-year-old. I would take him in first just to visit the place, meet the doctor, go to my DIY Child Life and scroll down. I think it's like the second or third from the top video, and you can make your own little dental tools and give those to him to play with, obviously under supervision because there's some small parts there and things when he's still little. But you know what to do, so trust your own instincts on what you do. Okay. Have I encountered any dentists who are resistant to using comfort positioning during visits? If so, what's the best way to address this? Yes, and the same with the doctor's office. Pediatricians aren't, pediatricians in the community are wonderful people. Pediatric dentists are wonderful people. But a pediatric dentist will also never show the needle, which I always find kind of interesting. It is kind of scary because it's in that metal thing. But I do tell my child that I have a school-age child, so I tell him when he was getting the numbing medicine, I tell him that he was getting a needle is how they give that medicine, but that they put something on there so that you won't feel it as much, yada, yada, yada. I have had to, I've had to work with some dentists on, this is a really young child. This is the first time they're coming, or a child with some special needs. Can this child just sit on the mom's lap while you count the teeth? During the parts that can be done from this position, can we do them this way? There are some things in the dentist's office that just are not safe to do in a comfort hold. So really, the things that I was talking about where the child sat in the lap and where the child sat between the parent's legs, those are really for those really young first couple of visits where all they're doing, from the time that they're 2 years old to they're a little bit older, they're really just, they go in to count teeth. They're counting their teeth. They're making sure they're coming in right. There's not, they might brush them a little bit. Then I think it comes down to just working with, just like you do with almost any other, any other doctor, that you have to sort of say, can we just try it? Can we just try this? If you have, I don't know about the dentist's office if there are articles out there about it, but if you have something that is an article that backs that up, then you're going to get a little bit farther. It's a tricky thing, and it's something that you have to sometimes go, you have to be respectful of the physician, but you also, if this is your child that you're talking about, you're your child's best advocate, and it's important that you also advocate for your child and go to somebody who respects the type of care that you want given to your child. Now, if this is within a medical center or it's not your child, then just like any other scenario, you kind of have to work your way through it. Let's just try this. Can we try this? If it doesn't work, then we'll go back to your way. But could we just try it? And then pointing out what did work from it and what maybe they could work on together, and finding an ally is what's really going to be the best way to address comfort positioning at the dentist. Any other questions? Yes. I don't know I'm trying to remember what age x-rays start. They do not start until they're a little bit older because they don't want to expose children to I was asked about x-rays during their visit to the dentist. I actually meant to talk about this a little bit, because the x-rays can actually hurt if they depending on what the dentist uses, if it's those cardboard pieces that they're going to bite on, sometimes those things sort of cut into the mouth, and although it's uncomfortable, it does have they're big, and in a child's mouth it can take up a lot of space. Excuse me. So I've used some cardboard that we've folded, and we've practiced on the doll, and we've talked about, I've also, if you take, I haven't made it yet, but I'm working on it, like a shoebox, and put a paper towel roll, cut a hole and put the paper towel roll in, like the camera part of it, and show how close it gets, where it comes to, how it moves around. You can show where it's going to go on a doll or a puppet, and explain how it doesn't touch them. The idea of if you're the parent and you have to step out of the room during the dental x-rays, you usually have to step to the other side of the wall. I use a piece of string. Child holds one end of the string. The the parent holds the other around the other side of the wall, and you can practice that at home with your kid also, almost like a hide-and-seek game, and you pull on the string a little bit so that you know that you can find each other, and you're sending each other love, and you're holding hands through the string. So, yes, before you go to the dentist, I would ask them, are you going to be taking x-rays? At what age does this normally start? I'm pretty sure that the first visit that you go, they don't do x-rays for a while. They usually don't start doing x-rays till the child is a little bit older because they don't want children to be exposed to that many x-rays in a lifetime. So initially this was intended for parents, but I can see that I have a lot of Child Life people in here. So Brittany wanted to know if this was eligible for PDUs. Yes, this live version, I think I have all your emails, so I will send out a letter to people. All right, then. I think I have everybody's name because everybody registered, so I'm pretty sure I've got everybody's email as well, and I will try to figure out from my, if you don't get a letter from me by the end of next week, then send me an email because that will mean that I did not have your email addresses. Some of yours I have just because you're in my system already. All right. Okay. Well, it is 2 o'clock and our time is up. And so thank you very much for coming to my Child Life Month celebration parenting webinar. And I appreciate you managing with my technical difficulties at the beginning, and hopefully I'll be able to work those through for the next one that I do. There are 3 more after this on the 11th, the 18th, and the 25th. So if you're not registered, feel free to register for any of those that you're interested in, or please pass along the information to families and parents and friends or people that that you think would be interested. The initial intent was certainly for parents, and so I'd like to reach that population as well. Although I always love talking to my Child Life friends, and I'm glad you guys got something out of this, or at least I hope you did. And I look forward to seeing you all in the future or in maybe one of my convenient classroom courses. So thank you very much. And I'm going to end the meeting.